let's just go over the basics about COVID. So I don't think you can hear them enough, because I feel like from the original 3 weeks ago to now, the symptoms have changed greatly, or symptoms have been added on, right? Because initially there was nothing about the lack of smell and taste. Originally, there was no talk about diarrhea. I'm sorry to be, but it's true. There were lots of things that weren't mentioned initially, but now there's different things coming up. So let's talk about some of the things you should be on the lookout for to see if maybe you think you have COVID.
Yeah, the main symptoms, and you're spot on. And by the way, I know Dr. Millette. She is awesome. She was a mentee of mine years ago.
Oh, wow.
It's a joy just to see, all that she's doing in emergency medicine, and just her matriculation. She has a great story herself. She's been through a lot in life and was able to overpower and overcome. But initially, when we were looking at COVID-19 or coronavirus, the most common symptom is a dry cough. You will experience a dry cough, is the most common. Body aches and fever. Those are the top three. Then people, as you mentioned, some patients will show up with diarrhea or nausea, fatigue, as well as what you mentioned earlier, a lack of a sense of smell. And so those are the top sort of complaints. And we wonder, is the virus still the same? Because the symptoms are starting to change or be added on a little bit than what they were before. There's no evidence to prove that it isn't the same at this point, but the thought pattern becomes that the virus is showing other sort of symptoms as the virus started to change its shape a bit. And the hope is not. And I don't want to propaganda put that out there as a possibility, because we don't know. As of what we know right now, the virus is still the same.